When I start discussing biologics with my patients, I do tell them it's a self-injection or an infusion, depending on what biologic we're considering. And often I'll have patients sort of worry about the whole injection aspect of things. And certainly the whole self-injection seems like a daunting task. And certainly patients sort of think in their heads that they'll be seeing a big needle that they have to inject. So I do tell them that most of the times these auto-injector pens have needles that are hidden. And that's the whole premise, to sort of keep the needle hidden so that it's not something that's fearful. And then I also sometimes say that, some of the injections are approved for children as little as 6. So you know what? If a child can get it, they can get it as an adult, just to sort of bring some levity in this situation. Can have some nice background music playing, or if they're, certainly if they've learned how to inject with their provider, that should make things easier. They can always have a family member do it if they cannot, for some reason, self-inject. And if there's a family member doing it, then they can distract themselves.
If you're nervous about pain, you can apply a topical numbing cream or ice the injection site beforehand.
So those can be ways to sort of take away the needle anxiety that patients might have. So if a patient is really petrified of needles, I've had some patients say no to self-injection. In that sort of scenario, I do tell them that we do have IV options. And I do have patients who are completely against any needle, whether it's IV or a subcutaneous injection. In that case, I do tell them that we do have oral options, thankfully, that we can consider. So if patients are really concerned or anxious about the whole needle injection aspect of things, we can certainly prescribe them anti-anxiety medications to help with the anxiety component. But it's important for patients to understand to address or talk about this anxiety component sooner rather than later, because the most important thing is, if a biologic is indicated for their psoriatic arthritis, they should be able to take it and continue to take it for as long as it works.